Substance abuse is a common problem of our times. Alcohol, drugs, and even prescription drugs can all be abused. When is it time to seek help? We ask the experts. I'm Lauren Aldi, and this is your Herald Health Minute brought to you by the Cape Regional Health System. To learn more about this topic, we spoke with Laura Albel, a licensed clinical social worker, licensed clinical alcohol and drug counselor, and senior program director for recovery services at Ascenda Integrated Health.
A lot of times people think that substance use or substance misuse has a certain look to it, meaning somebody who really can't hold a job or has legal problems due to their substance use. But there's a lot of varying degrees of substance use disorders. So it doesn't look the same for everyone. In terms of defining what it means, it really has a lot to do with how that substance use may affect the person's functioning in their daily life. One of the things that we're noticing now during the time of COVID-19 is that people are using substances more than they have in the past. So somebody may have been someone who used alcohol socially or in rare settings, and now there seems to be a lot more social acceptance of increased use. Sometimes you'll see even advertised on television happy hour Zoom calls or cocktail hour Zoom calls, and there's this encouragement of alcohol use to deal with the stress of the pandemic. One of the ways that a person might identify that there is some misuse of their prescription medications is using up their prescribed amount in a quicker amount of time than how it's prescribed. One of the things that you may hear in the treatment world is somebody might need to reach rock bottom in order to get better, to get help, or to move forward. And at Ascenda, that's just really not the case. What we do is in counseling is we raise the bottom. So what we do is, somebody doesn't have to go through every negative consequence due to their use in order to get better, to turn around. We offer a range of services at Ascenda to address substance use disorders. That goes all the way from outpatient care, one-on-one counseling, as little as one time a week. We also offer a range of medication-assisted treatment to address alcohol and opioid use disorders. A lot of times people think that they have to fit a certain stereotype of someone with a substance use disorder, and then in order to get better from that, you have to go to a 28-day rehab, and that's just not the case. There's a lot of different resources out there and a lot of different formats, so even outside of the realm of treatment. So there are mutual support meetings within the community for individuals who are struggling with substance use, as well as their families. We can't force people to want to make that change, but what we can do is highlight the discrepancy between what they say they want and their behavior. Well, one of the biggest things that we do in treatment is finding an alternative to use. So there is a large behavioral component in substance use. And so you can't get rid of a behavior without replacing it with something else. So one of the things that it may be important is helping a person, especially during these times. What interests does a person have? Either if it's reading or doing artwork or going out in the community, being outside. There are still some things that people can do even during the heaviest of lockdowns. And that's really important to work on and kind of develop and explore, because those are the long-term hobbies or activities that will be a really great support for them when they're struggling.
For more Herald Health and Wellness reports, visit the CapeMayCountyHerald.com and click the Lifestyle tab. This health video has been brought to you by the Cape Regional Health System. For information on services and for a healthier life, call 609-463-CAPE.